I'm Edie Lush, and I'm outside Hub Culture's Ice House here in Davos. Really pleased to be joined by Hammond, photographer, storyteller, Seema Kumar, head of innovation public health communication for Johnson & Johnson, and one of our partners here in Davos.
Nice to be here.
So, we had an incredible evening last night, Robin, with you showing some of the most stirring pictures I've seen, illustrating the problem with mental health and the world's inability to deal with it. Tell me a bit about your journey and why you chose to focus on mental health.
Well, I mean, really, I stumbled across it. It wasn't something I set out to do, but throughout my career, I've documented conflict and displacement and difficulties people have faced, but I've never really thought about what happens after the peace treaty is signed or the flooded waters recede, or what are the mental health impacts of these crises. And when I came across a prison in South Sudan and I found people with mental health issues locked up in there, it really inspired me to try and help to tell their stories and elevate their voices so that they can be heard. And mental health is such a neglected issue. I think we all should be paying more attention to it.
What was the image that shocked you the most, or that still haunts you?
Well, the image of a young man who was naked and shackled to this prison floor in South Sudan was, I think, the image that really moved me the most to try and do something for people like him in vulnerable situations like that. And it continues to this day. And that was 7 years ago, and I often think about this young man and what has happened to him, as I do with many other people who I've photographed. And what I would really love is that for these images to really make an impact on their lives and to influence people who have the power to make a difference for them, so that they can have the chances and the opportunities of life that we all take for granted.
Seema, I'm really interested in why Johnson & Johnson chose to focus on this issue of mental health. Tell me a bit about your journey in that too.
Johnson & Johnson and Janssen, which dates back to Dr. Paul Janssen, has been involved in mental health for a very long time. Dates back to the discovery of Haldol or haloperidol, which was the first drug discovered for schizophrenia. Until then, patients actually were in straitjackets or in asylums. And so that drug, and followed by that Risperdal Consta, Invega Sustenna, and now Invega Trinza, which is you take a shot 4 times a year, has helped a lot of patients, lead normal lives with mental health issues. And so while we have made so much progress here in the West, we continue to find the big challenge in places around the world where patients are still chained, shackled, and treated very poorly because they have mental health issues, and it's very ill understood. And so a few years ago, we came up with a prize called Breaking the Chains of Stigma, because stigma is a big issue in mental health. And Robin, who actually, the photograph of this young man in Sudan, who was on the cover of this book called Condemned, caught our eye. And when we saw those pictures, a picture says 1,000 words, and when we saw those pictures, we said, oh my God, this is what needs to be, this is a story that needs to be told and highlighted. And so that's how we came to know about Robin, because Robin won the award that year from Janssen. And then, of course, we followed Robin's journey, and we feel like we still have to make a lot of headway in mental health in places around the world where patients are still shackled. And so we want to make a difference. We think that we have a way to use innovation along with awareness and stigma, breaking the stigma, to make some progress there. So, which is why we wanted to focus and highlight mental health here at Davos.
Tell me about how you think innovation can help spread into these areas that Robin has highlighted, which aren't receiving the drugs that people need. They don't have the education or the awareness of what to ask for.
So one example, and I'll just use this one example, is that we have a long-acting injectable of a schizophrenia drug, which can be used in infrastructure-challenged areas of the world, where you perhaps could take just one injection twice a year, perhaps. We still have to go do a lot of research, but also take mental health care, which is now centralized in specific asylums and places, and actually integrate it into primary health care. And of course, education, breaking the stigma, all of that goes along with it. But one example of an innovation is something like that, which could actually help patients deal with, be symptom-free for long periods of time without having to see a doctor often, which can, be a huge burden on the healthcare system.
What did you notice about the areas that you traveled to? Who was trying to treat these people? Was it doctors or was it other members of the community?
I mean, in a lot of cases, mental health is seen as a spiritual problem, so people seek spiritual remedies. And so, on many occasions, it would be a religious leader or a traditional healer who would be the first port of call for people with mental health issues. And a lot of people just don't have access to modern medicine and all the awareness really of what their mental health condition is at all.
I mean, one of your pictures is of two religious people trying to, I don't know what they were doing, they were trying to sort of bewitch somebody who clearly was suffering from mental health.
Right, so in a lot of communities, mental health is seen as or mental illness is seen as a curse. And so, there's all sorts of methods, praying over people, and all sorts of other kinds of things they do to seek spiritual remedies. I mean, there is, I don't want to pass any judgment on that. I think that, for a lot of people that is at least some positive attention. Sadly, it isn't always positive though, and it can verge onto being abusive. So really, it's an access issue, but also, and obviously, access to medication and access to proper healthcare.
Yes, absolutely. But also, if you walk the streets of New York or San Francisco, you see homeless people on the street, and not all, but some have to do with mental health issue.
Yeah.
And there is a lot of incarceration and imprisonment of people who actually have mental health issues in the United States even. So, so I think our work is not over. We have a lot of innovation, we have a lot of awareness raising, but I think that we believe that when we say health is a key priority and a key enabler for healthy societies and healthy economies and a healthy world, we include that to mean not just physical health, but also mental health. Just as there is focus on cancer or infectious diseases or heart disease, there should be a focus on mental health because that's just as critical.
So I'm interested in the spectrum of mental health diseases, and you mentioned one of the drugs that is used to treat schizophrenia. You've also mentioned the scale of the problem around the world, and also in a relatively developed country like the United States. When I go home to San Francisco, I'm amazed, given in the difference between there and London even. So how do you put those two things together? Is it bringing down the cost of the drug? How fast can that happen? What is it?
I don't think that there is a single magic bullet, right, in any of this. Yes, I think innovation and a drug can help, but it has to be surrounded by multiple other things that provide an integrated solution, a healthcare infrastructure, physician systems and primary healthcare providers and nurses even who are all aware of what this is all about. And we say mental health and we put a spectrum of diseases into that, but they're all different. And so I think there is a lot of work to do. So I think there is no single magic bullet, but there is something that we can all do by bringing a surround sound of things towards the situation, and that's the hope. And it all starts with, I think, to some degree, if I may say so, breaking the chains of stigma, because the stigma around mental health is, and it's ill understood still. So I think that is something that we also have to work toward.
And I think I'd like to echo that. I think that stigma is the greatest barrier to people receiving proper treatment. It's what stops people funding mental health care. It stops people going for treatment in the first place, and it stops us even talking about it. And I think we really need to there is such a shame around mental health. If you ask a room of people, who has survived cancer, people stand up and they're applauded, but no one would dare ask who survived mental health. So a mental health problem, and like cancer is also a range of conditions, yet we don't say, it's too complex, therefore we can't tackle it. There's sometimes a reason why mental health issues are not fully understood or tackled in the right way. So from my point of view, and maybe I'm biased on this, but I think that we need to start talking about it. We need to start having people with mental health issues heard and seen, and it's only then that they can be valued.
And you know, Robin made a great point last night, which is that you know, we have to hear patients' voices. So whether it was HIV or breast cancer or what have you, it was the patients' voices and the advocacy of the patients themselves that actually had a huge impact. And so we need to actually hear the voices of patients who have, you know, and when I say mental health issues, it ranges. So it's a variety of different kinds of conditions, but we need to be able to listen to those voices and hear what it's like. And the other thing you did, Robin, yesterday, which was so fabulous, is that your pictures and your narrative and your storytelling. After the session, a lot of people came up to me and different people said, my mother has suffered through this, my cousin has suffered through this, etc., etc.
It touches everyone, doesn't
It touches everyone, but because of the stigma, it's not something that people are proactively coming forward with, because there is this stigma and a sense of shame around, you know, mental health issues.
Well, I think when we talk about our own mental health issues, it gives other people permission to talk about theirs.
Yeah.
And it's a ripple effect, you know, and I think that we just, you know, we need the courage to be able to speak about it.
Absolutely.
Robin and Seema, thank you very much for last night and also for speaking with me here.
Thank you, Edie.
Thanks.
Pleasure.
I'm Edie Lush.